Hello and welcome to Health Matters on Channels Television. It's great to have you with us. I am Mary Alale Yusuf. Children may need braces or other dental appliances for several reasons, including crooked, overlapping, and overcrowded teeth. A malocclusion or bad bite is also a good reason for a child to be fitted with braces. Dentists say apart from a nice, even, and confident smile, well-aligned teeth in children help with oral health. In the studio with me to talk about orthodontic health in children is a dentist with a bias in orthodontics, founder and managing director of Smile 360 in Lagos, which has won the Nigeria Healthcare Excellence Award for Best Dental Practice in Nigeria back-to-back since 2015. Dr. Amy Traore Shambusho. You're welcome to the show.
Thank you. Thanks for having me.
Let's understand what well-aligned teeth are supposed to look like in a child, first of all.
Well-aligned teeth in a child, I would like to break it down when they have baby teeth, permanent teeth. A lot of time, they don't work together. And parents come to us saying, what's wrong with my child's teeth? They look too big.
Okay.
So I usually tell them, look, they're fine because the face and the jaws are still too small. So as they grow, those teeth will now balance up, with the size of the face. So those teeth should look well aligned, but I will be happier when I see gaps between the teeth in a child, because I know there are more teeth that will come in, and seeing gaps means that we're going to have sufficient space for those teeth. So nothing to worry about when you have spacing between the teeth of a child. But when you have the teeth that are overlapping and crowded, it means it's going to be even worse as the child grows. Yes, the child will grow, but remember that the adult teeth will come in a bigger size.
Oh, so bigger than the baby teeth?
Baby teeth, yes.
Okay.
So obviously they will need more space. The jaws will grow, but tendency is that we will have a bit of crowding at the end.
Now, this crowding and other problems, is it an inherited factor?
Oh, we have various factors. We have an inherited factors, of course, where you could take your mom's jaws that are a bit too small and then inherit your dad's teeth,
which might be big.
A bit bigger, put it together. There's nothing that you've done, but you end up having a discrepancy between the size of your jaws and your teeth, and the teeth start overlapping. Or it could be the other way around, where you have dad's jaws that are bigger, mom's teeth that are smaller, and then suddenly you have
so there'll be lots of space in the jaw.
Extra spaces between the teeth, and sometimes, for health reasons and aesthetic reasons may not be pleasing.
So you handle that too when the jaw is too big and the teeth don't quite cover the space?
Definitely. Coming to an orthodontist, you know that those conditions will be taken care of. So
when should a parent be bringing their child to you for the first time?
Let's break it down. I'm a dentist with 25 years of experience, specialized in orthodontics. So as a dentist, you should bring your child on his first birthday. First birthday. Now, if you are doing the right thing in terms of checking his teeth, what he's eating, you may have a grace of another year, and you can consider that from 2 years old, you could bring your child to the dentist. But coming to the orthodontics, 7-year-old is the age to come.
But when the child is 1 and they bring him to you, can you at that time notice that this child may have a malocclusion later in life? I might need to be seeing him for some alignment troubles.
At 1, I will say no. But if there are some habits, at that time, we could already start talking about how to take care of those habits, just so the baby teeth don't get worse, in a worse condition. That could affect also the permanent teeth. But at that age, at 1, it's really for us to bond with the children, to already make sure that they're familiar with the environment, and then the parents are not transmitting their fears to the child, so we can bond and win a friend as early as that work. It works.
So when the child comes at 7, he's not scared?
Oh, they're super excited to come now to the dentist, unlike, the old generation that you have to almost drag into the dental office. So things have changed.
Tell us about some of these habits that could cause a problem.
Sucking, thumb sucking, tongue thrusting. So those are things that could deform the jaw and displace the teeth in a permanent way. So I usually tell parents, look, let me have a look at that age. But for some reason, the child needs some form of comfort by sucking and, so I will only worry when we get to 7 when he start having permanent teeth. But at least from that early stage, we could start telling the parents, look, try putting, some bitter nail polish or even better, bitter leaf that we have, here, and try counseling the child to start, making sure that he's, taken away from those habits. But really it's at 7 when we start having those permanent teeth that we can come in with some appliances that are called habit breakers to be able to start the habit, because then, we could have some permanent deformations on the jaws, and we don't want that.
Okay, so if a child is brought in at 7, 8, 9, and you have to fit him with something to realign those teeth, is it a case of, the earlier the better? If I can do it now, then he doesn't need braces later on in life. By the time he's 16, and he's getting interested in the girls, he has this flashy smile. Is that the case?
Mary, that's a great question. Now, at 7, you should have your first orthodontic check. But a lot of time, I'll say 2 out of 10 kids start the treatment early, either because we've seen some discrepancies that we talked about earlier between the teeth and the jaws, or we've seen some habits, that could affect even his chewing, his eating, his speech, the way he's breathing, just to let you know that what we see in the mouth has a great connection with what is happening in our body. So at that stage and age, we need to stop any condition that could affect the general health of our patient. But if we have a treatment at that stage, 3 scenarios, you may not need to have a treatment much later because we put everything on the right path and all the permanent teeth just fall in place and you're good to go. A lot of time we could reduce the length of treatment and the complexity of treatment if we start early.
So it's still good to come early?
It's still good to come early. It's still good to start early. But as I said, only 2 out of 10